Let's talk vaccines. All right. This is probably the number one topic that people, when they inbox me for the show or they ask about topics, this is, if not the top, one of the top. There you go, Mork. One of the biggest, subjects that people want to talk about. They want to hear my opinion on. They want to offer their opinions, and so I thought, good time to talk about it. Okay, and the fact is that vaccination, when you start to talk vaccination in both humans and pets, a lot of times it does spark debate, right? Between clients, doctors, and veterinarians. So I think that my purpose today is to just give you my take on it. I do take what I feel like is an integrative approach. Okay, I think. And the purpose today, I think, is just to have an open discussion, right, about vaccines. I'm going to give you my opinion and what their uses are for our companion animals in small animal medicine. All right. I think it's important to, as we start and off the top here, to kind of let you know that my stance is, I openly do believe in vaccination. Okay, I do. However, I believe in judicious vaccination, not blanket vaccination, judicious vaccination. And what I mean by that is just, again, as you guys know, as I talk about with all facets of veterinary medicine, what I believe in is approaching each animal as an individual, because they are just like people. There are no two animals. It doesn't, same breed, it doesn't matter. They're all individuals. They're all different. They all have slightly different circumstances, right? And there's a number of things: age, pre-existing conditions, what their environment's like, where they live in the country. The list goes on and on. So it's really important with everything in any sort of, when you look at any facet of veterinary medicine, that you take the animal as an individual and you look at their situation, and then you cater something for them. Okay, because there's not one size fits all with anything. Okay, any sort of medicine, vaccination just doesn't work that way. So I think that's the most important kind of take home from this is, I believe in judicious vaccination, and we'll get to why and what that means to me. Okay? All right, let's talk about what the purpose of vaccines are, right? So, kind of simply and understated, the purpose of vaccine is to produce an antibody reaction by introducing certain contagions in a weakened or dead state into an animal to provide them immunity to that contagion. Okay, that's very simple. That's kind of the basis of all vaccines, and that's been the basis of vaccinations since they were created. All right, and one of the other things we're going to get at is, it's also important to note that the vaccines that we have now are not the vaccines that we had 20 years ago, 40 years ago, 30, it's their science continues to improve on them, and we'll talk about some different ways they do that as well. But so, it is, once again, you always have to continue as a clinician and as a client, a pet owner, have to continue to learn about these new things and advancements and advancements in how we vaccinate and when. Okay, so I think that's also very important. All right. So different types of vaccines. You may or may not know this. There are live vaccines where the agent that's put in is a live contagion. Okay. There's modified live where they make some modifications to it. There's obviously killed where the contagion is not virulent when it goes in. And then there's other kind of newer vaccines, things like recombinant vaccines and process vaccines. And it's interesting. It's just to kind of give you an idea of kind of where vaccines have come from, and how far we've come with vaccines, right? You take a Lyme vaccine, for instance, and some of the newer Lyme vaccines. The history with, a lot of especially in this area of the country. The history of Lyme vaccines is that when they first came out on the market back several years ago, and they came out in the market. They were causing joint issues, and people were having issues. They pulled it off the market for people, and kind of some of the same things were happening in those initial phases, right when I kind of first got out of school with animals. And then science adapts, and they developed, and they found that instead of taking the whole Borrelia burgdorferi, the whole Lyme, and just introducing it into, deactivating it or making it modified, they found that they could actually just take pieces of the outer shell protein, and so that you cannot have any return of virulence, and that the body will identify those and can make antibodies just based on that outer shell, which is really quite an advancement, right? So we have better vaccines now, all right, and that's good. And I think one of the things that continues to kind of be perpetuated in some circles is this belief in that veterinary medicine, that there was over vaccination. Okay, and I will tell you that I think again, I've been out of school 25 years, and when I first got out of school, I believe that was true. I think a lot of, and it was just based on the knowledge and some of the lack of knowledge on how long vaccines might last. So back then, oftentimes they would give animals every year, 3-4 vaccines, same time, same place. And so I certainly think that was true in the past. And I think that we've come a long way. I think a lot of clinicians feel very, very much like I do, which is to vaccinate by need. Okay, and vaccinate the individual. What are their risks? Where do they live? What protections do they need? And I think that's really, really important. Okay. And again, like they've done so many different adaptations as we've gone. Back when I first got out of school 25 years ago, they did vaccines, like I said, all in the same place. Now they've learned you give certain vaccines in certain places, because if you ever get a local reaction or something like that, you know exactly what the vaccine is. Instead of having a bunch of vaccines in one spot, how do you know, right? Hey Marianne, thanks for tuning in. Yeah, we're gonna talk titers in a little bit. I think they're very important, and we'll get to that. All right. So I do think that the veterinary community as a whole approaches it much better than they used to. Okay, there's still room for improvement. I get that, but I think they do. All right. When we think about vaccines for our companion animals, they basically fall into 3 categories, right? We put rabies by itself. It's the only vaccine that's required by law. And the reason for that is that there's zoonotic potential, right? A zoonotic disease is one that can cross from people to animals and animals to people. It is also a fatal disease. So obviously in vaccinating animals, you're not only protecting them, but you're protecting their owners as well. Okay, very important. Very serious disease, extremely important. All right. And then there is what they call the core vaccines, right? And the core vaccines are things like canine distemper, which generally, when you say a distemper vaccine, generally could be multiple in one, oftentimes is. Distemper, adenovirus, parainfluenza, and parvovirus. The big 2 in that are distemper and parvovirus, okay? A lot of those diseases, and feline distemper as well, is generally multiple. And so, and those are the diseases that are serious diseases and can be fatal at times. So that's what we call the core vaccines. And then we get to what they call the non-core vaccines, right? And those are other vaccines like the Lyme vaccine or kennel cough, Bordetella bronchoseptica, okay? Things like leptospirosis. We'll talk about that a bit. So that's basically kind of how we kind of, when we talk about putting them in categories, that's generally where we place them. Feline leukemia would be another non-core vaccine, okay? And so there's a lot of different factors that go into which ones, when, and how, okay? All right, let's talk about what's improved with vaccines, all right? And protocols, because the improvement is not just in the vaccines, it's in the protocols as well. And I think that's something that's very important to talk about. When again, 20 years ago, 25 years ago, they used to do many of these vaccines annually, okay? They didn't really have the backing studies to know how long they could provide immunity. So in an effort to make sure that the animals were protected, they would give many of these vaccines every year, and oftentimes in the same place. Now we know that many of these vaccines can last a great deal longer. So we have vaccines that are dated for 3 years. So that limits the amount of vaccines that the animal has to get, okay? Absolute better technology, right? So just to give you an example, one of the things that was happening back, and can still happen, but one of the things that the veterinary community learned just about the time that I was coming into the field was that cats were getting a certain type of tumor called the fibrosarcoma, and it was cropping up at vaccination sites. And so what they started to study is what in a vaccine could cause these growths, because they were absolutely seeing them at the spots like the very back of the neck, okay, between the shoulder blades, where they used to give multiple vaccines at once. And what they found out is that cats, even more than dogs, get inflammation at the site of these vaccinations, and they mostly react to what's called the adjuvants in the vaccines. And so an adjuvant is something that they add in, so you have your Lyme, okay, in a Lyme vaccine, and then they would add in an adjuvant, and that helps the uptake in the animal, okay, to disseminate it through. And so the adjuvants were shown in these cats to make their inflammation worse at the site. So what they did was they actually they've now created non-adjuvanted vaccines for cats, and especially the rabies that we're using with cats is not a multiple year, it's a 1 year generally, but it's a non-adjuvanted, so it's much safer for the cats. And that's again, that's just better technology. And to be honest with you, knock on wood, the amount of those just in changing protocols, just in splitting vaccines, just in better technology, non-adjuvanted vaccines, we have dramatically reduced the amount of those fibrosarcomas that I see. Again, knock on wood, dramatically. It was, when I came into the field, a fairly regular event, and it just is not nearly to the degree that it used to be. All right. So here's kind of so we talked about different vaccines. We've talked about what they've done as far as protocols and science. So then what I thought we would focus on is how do we approach how do you approach vaccination in your pets? Because I think this is really ends up being kind of the take home to this, right? Let me just get to the people checking in here. So Marianne, I know you said you did titers, and again, we're gonna get to this in this next section. But you said she had vaccines as a puppy, and after 4 years, only titer, and she still is protected at 11 years old. She just had her titers in July, and she's still protected, and that is an excellent point. And I'm gonna talk about it again. We're gonna talk about it. We're going to talk about it in this next section, because I think this section really, like I said, is going to be the take home for this, because I think when you approach these, look, we all have a trust and a bond with our veterinarians. The clients and the client's patient and the veterinary bond, to me, is a really strong bond. It's like a family bond, and so these discussions are something that I really implore people to have with their veterinarians as well. And I have these kind of conversations with my clients all the time. And my job as a veterinarian is to do the best that I can for the overall health of each and every single patient, right? And that does involve talking about, okay, what's unique about your pet, and how do we cater to that, right? Thanks, guys. Yeah, I do think this is an important discussion, so thank you. Okay, so how do we approach vaccines in our pets? One, you want to have an open discussion with your veterinarian about your dog or cat's risks to certain diseases in the area. All right. So what's that? Let me give a couple examples of that. Let's talk Lyme vaccine, right? All right. So obviously we in Connecticut are in the hot zone of tick-borne diseases. Okay. And so if you're And you know, I think there is sometimes a little bit of a misnomer with people where they'll say, well, my dog just goes out in the yard and, you know, so the risk is low. Well, there is in this area, there are ticks everywhere. Now, getting back to that is if you hike in the woods every day with your dog versus a dog that it goes out in the yard, goes to the bathroom, goes inside. Yes. Is that hiking dog at a higher risk? Of course. But you have to be careful in this area because there are, you know, I've had sometimes, you know, animals that go out for 2 minutes and come in that have 2 ticks on them, you know, so they can be anywhere because you got to remember too, at night, possums, raccoons, and everything, they're running all over and through our yards, okay? And so, you know, they can bring fleas, they can bring ticks with them, and they can really be anywhere in the environment outside. So, but there are also areas of the country, okay? There are areas of the country where the Lyme risk is extremely low. Well, you wouldn't discuss that, you know, you wouldn't entertain that vaccine because if the risk is very, very, very low, then that's not something that you would need to do for your particular dog in that area, right? Now, and conversely, there are some teacup little dogs that are apartment dogs that use wee-wee pads and don't, you know, may go outside quickly on pavement that don't, you know, and they're not going to need that, okay? So you always have to talk about the given situation. Let's see, Michael has a question. If my dogs are on flea and tick preventatives like the Nature's Protection from EA or Seresto, do we still need to get Lyme vaccines if the dogs aren't getting any ticks? Awesome question. I talk about this all the time. Obviously, if they're on a good flea and tick protocol, all right, then their odds of getting Lyme go down, of course. If you can prevent ticks, you can prevent Lyme. Now, the one thing that we do know, right, is that none of those are 100%, okay? Ticks are really hardy. They've been around a real long time. Our weather's changing. We don't get much of a die-off. Tick-borne diseases are on the rise. So you have to make that call based on what area you're in, right? If you're in just a really hot, you know, hot endemic area for it, you might consider it, right? If you're in an area where you just don't see them, there aren't a lot of ticks. Your animal is at a low risk. Well, that's a different story, right? So again, I think it's individual, and it's individual even in given areas, right? Just have to talk to your veterinarian and make a plan for your dog in that case, all right? So it's just another example of different, you know, whether or not you would give a vaccine. Feline leukemia vaccine in cats, okay? If your cat is indoors only and does not go outside, has no risk. Feline leukemia is carried by body fluids. You know, most of the time it's because outdoor cats, if they come into another territorial cat, they can get in a fight, right? Well, feline leukemia, if you have a cat that lives on the 10th floor in an apartment cat that has absolutely no risk of going or getting outside, you're not going to give that cat a feline leukemia vaccine. It doesn't need one, okay? So you have to establish that. Really important, okay? Number 2. You have to take into account the different components to your animal's life, right? Age is something you have to consider. Pre-existing conditions, this is a huge one, right? I've always talked on the show, I think, you know, preventative medicine good preventative medicine includes checking blood profiles on these guys and really looking at their core health, right? Because certain pre-existing conditions, immune problems and things might prevent you from giving vaccines, okay? Certain vaccines, all right? So pre-existing conditions are huge. And that would also affect your protocols, okay? and obviously age, like you said, Marianne, right? That Georgia still titers out, and titers are next, guys, at 11 years old. So let's talk titers. So, and this is number 3 and a big one. There are now titers available for certain vaccines. Okay, here's an example. And a titer means a titer checks an antibody level. Okay, and they have now done enough research where they can see they have levels where if the antibodies are at a certain level, then that most likely means that that animal has protective immunity against that certain contagion. Okay, so let's talk distemper and parvo like we were talking before, right? They have a distemper and parvo titer. So instead of getting a distemper and parvo vaccine, which again, they've done a good job in making these, certain multiple years, right? However, if you can titer that and your animal titers out to it, that means that they have supposition protective immunity, okay? So they don't at that point have to get that vaccine, all right? And that's great, and that's big, because again, the less things that we have to put into our animals, ultimately the better, but we still want to keep them safe, okay? Let's talk about, let's go to the questions I have. We'll talk about another titer in a sec. Yeah, Rebecca, I know. Hopefully they continue to improve these, and we continue to be able to titer things as well. As they develop more titers, less vaccines, it's a win-win, right? All right, Stephanie, how do you discuss and handle the clients that come in with paperwork basically forbidding certain vaccinations when we know that some of these vaccines are important? Well, and so how I handle it always, Stephanie, is an open discussion. My opinion, given what they're again, going back to pre-existing conditions, going back to the age of their animal, going back to what they've had in the past, and yeah, I think you have to be careful when you're polar on one side or polar on the other. I think you have to weigh everything, to forbid certain things, especially if you're in a really endemic area. I think, again, it depends on, if you talk about leptospirosis, right? Leptospirosis is leptospirosis is a disease that is carried in rodent urine, okay? And it can attack animals' kidneys, it can attack liver, it can be a pretty serious disease, right? Now, there are areas where it is very prevalent, and there are areas where there is not much of it, okay? And so, again, that's a big one that you have to weigh, what your animal's risk is. Okay, and so when we get to that, where they're forbidding, I think you just have to have an open conversation and say, okay, well, there's certain ones on this list that we're in this area we don't see, okay, and then there's certain ones that we see a lot here, and we have to talk about that. So I think it's just, Steph, to me, and I know you're just like me. Stephanie, by the way, is a veterinarian as well, and a classmate of mine from vet school. And the two of us practice very similarly, but it is always that open. We probably talk too much, frankly, but it's that open line of communication. I think you just have to educate people on what you think, and again, always doing what the best thing is for their pet. Okay, just quickly going back to. Tina, rabies is across the board required. Okay, it's a law. Okay, now they do have a titer available for rabies. All right, they do, and let's talk about that. You can have your animal. It used to be only where they used to only have a titer. It used to be they didn't have a titer. Then they developed a titer for export animals. If you were moving or visiting a country, say that was rabies free, they had a whole, you had to do a ton of different steps because obviously they don't want to introduce rabies free in some of these places that obviously they don't want to introduce rabies into a rabies free island or one of the other places, right? So anyway, but they have now developed a titer for rabies that we can titer, and they do have a level where they believe is protective immunity, okay? And if your animal titers over that, then they likely have protective immunity, okay? Great. Here's the downside. The state and state governments, okay, don't recognize that as a vaccine. So what does that mean for us? Well, if your animal does not have a current rabies vaccine, even if they have a titer to rabies, okay? So they got a titer, it titers above that, all right? It titers above protective immunity, and they for all intents and purposes, should be protected against rabies. If they have an incident, if they get in a tussle with a wild animal, or they get in a tussle with another dog, or nip a person, they treat them as if they're unvaccinated. Okay, and that's what we have currently. That's the unfortunate kind of situation we're in. And what do we use those for? Well, we use those titers for animals that have had, God forbid, a very serious reaction in the past, that it is unsafe to vaccinate them again. We still know the risks involved with that, but if we titer it and they titer out, oftentimes we can get, sometimes we can get a dispensation from the state that says for the next year that they're okay to get their license, okay? But it still has that caveat to it. And my hope is in the future that caveat's going to be taken away. Okay, that some of these things will be recognized. Okay, because I think that's important. I do think that's important. So, hopefully that's going to be coming down the road. It's great that we can do it. It's just that that piece of paper doesn't mean a lot if there's an incident. All right. Do I think that's unfortunate? I do. All right, but I also agree that you have to protect against rabies because it's fatal. And it's not that there's no treatment for it. Okay, so it's let's see, Tina. Oh, I skipped over you. I used Frontline Plus for my pup. Did use Cordelio once and changed. Heard horrible things about. Tina. I think that any one of the things about the flea and tick prevention, right? The classic, and we've talked about. We actually did a full show on it a month ago or something else about these various, about the traditional kind of flea and ticks. There's several of them, right? I don't have to name them all right? And we were comparing to things like the earth animals, the nature's protection, which is a natural line. And while most of them have a small, other than you don't want to go into stores and buy the old organophosphate collars or things like that in a supermarket, or you need to do your research on any of your flea things, because there's some flea and tick things. There's some things out there that are downright dangerous. Okay, but most of them are neurotoxins for the parasites themselves, okay? And while they do have, most of them have low side effects, they can occur, okay? And one of my points in the past is if you can do it naturally and it's working, then why wouldn't you, right? So I think it's always good to look into that, and you just want to do your research, all right? It's important. Another thing that I think is very important, that I talk to people about all the time, and my clients, and I know Stephanie does this as well, and my clients are used to this. And look, does it require more work on their part and our part? Yes. And what I'm talking about is splitting vaccines, okay? I try very, very hard not to do multiple vaccines at once. All right. And I've actually done that since I was out of school, when it was really not, when they really weren't doing that. You're welcome, Tina. When they really weren't doing that, okay? And it just makes sense. When you introduce a vaccine into an animal, their immune system pays attention, is using it and making antibodies against that, right? So to me, it always made sense to try to split up vaccines so that you're not overwhelming the immune system, and that you can, it can pay attention to what it needs to do. All right. I think I've also spoken to veterinarians that are in a lot of these companies that are, yeah, I know. Yeah. You and I have done that literally since we got out of school when it really wasn't commonplace at all. And I think it's above medicine and above good medicine. I think it makes common sense, right? And so what I was saying is I've spoken to, different veterinarians that work in the creation of vaccines, and what they recommended as a good time frame is at least 2 weeks. Okay, now I'm not talking about sequential when you have a puppy and you have to do a couple, those are done at 3 weeks to 4 weeks. But I'm saying if they come in further, if they're in an area and they need a Lyme and a rabies, I do the rabies and I wait at least 2 weeks to give them the other one. And it is something I've done always, and it's something that my clients appreciate, and they're willing, they're willing to come back again because it's for the safety of their animal, right? And so we're all willing to go. I mean, look how far we would all go for our animals, right? And it's something, it's just, to me, it's smart and it's just good medicine, all right? So I think that's really the core of what you want to think about when you're talking to your veterinarian, and approaching your vaccination protocols in your dogs and cats, right? Okay, let's talk just quickly about some side effects that we see with vaccines, right? I think the first one and the most probably the most common but the least severe is local reaction and some pain at the site. Okay, so anyway, it is and that's usually just transient. It's still fairly rare, but you can see it. The second thing that you can see with vaccinations is obviously more severe, which is like an anaphylactic reaction, okay? A quick allergic reaction that usually comes up within 90 minutes after the vaccine, and that can vary in severity, okay? It is very rare. They've done several studies on it, and it is actually the odds of having an anaphylactic reaction in pets is considerably less than 1%, okay? So it is rare, but we do see it, okay? Now the good news is generally it does respond very quickly to treatment, all right? But this can be something that is, when it happens, can be severe and can be, occasionally difficult to deal with, right? Let's see. William Hanson, Chris's titer measurement of antibodies. Yes, a titer is a measurement of antibodies that your animal has to a given, contagion, okay? Tina, learned my lesson on this the hard way. 5 pathologists didn't have a clear answer to her anemic crashing, then passed a 2.5. Oh, Tina, I'm so sorry. Oh my God. Yeah, that's terrible. Let's see. I'm so sorry. Another Tina. My pup will be 5 months old on the 27th, and I've yet to meet my vet due to COVID. They have a very small office and have to follow safety protocols. Yeah, I will tell you, honestly, Tina, this has been really tough on veterinarians and their staff and pet owners. We're still doing curbside at my office. We're going out and in with the animals. Weather. Earlier last week for 2 days it poured, and we were just out there in the rain. And you're having to get the animals and take them away from their owners. Sometimes they're more scared because the owners can't come in. And yet it is not ideal. And we're thrown into this situation. None of us want to be in it, but we just have to get through it. And the hope is that as we get into next year and we they're developing more treatments and hopefully a vaccine, that we're going to get back to some normalcy. It's going to be a bit, it looks like, but yeah, this has been very hard. Trust me, not only on the pet owners, but on the veterinarians as well. It's not an ideal way to practice. It also, because of all, because of all the safety protocols we have to put into place. Oftentimes it takes us longer to get through appointments, so sometimes the wait is a little bit longer, and I think it's hard, and it's hard for people who are probably expected to be in meetings. They have to get home with patients, and I think one of the things that I try to tell people is, to me, it's just, we have to really work, all of us, including me, because I can get as frustrated as anybody with the situation. Just continue to work on patience and realize that we're all in this together. We're all in this situation. None of us want to be. And it's just, if we work together, it's going to be a lot easier than if it gets cantankerous and we're all losing patience with one another, right? Oh, I'm sorry, Tina. Yeah, I again, that is something that's rare, but there's a reason why. I split up my things, and that's, I'm always a big err on the side of caution person as much as possible, right? Okay. All right, so Jessica said that vet said, as long you aren't in a super high risk area, but as long as you are on flea and tick preventative, your vet didn't think that I assume you're talking about Lyme vaccine. And yeah, again, and that's a situation where your veterinarian knows your area, knows the risk, and so that's what it's all about. That's right there is exactly what I'm talking about, right? So thank you for that. Oh, Tina, I'm so sorry again. So sorry. The other thing too is that, the other one, we touched on it earlier, but kind of last thing we'll talk about as far as vaccination, reactions. Tina was talking about that as far as, when they can have, especially if they've got a propensity for immune, something immune, this can cause issues when they have a lot of things introduced at once. So you have to be careful. And we talked about the fibrosarcomas in cats that we used to see. The good news is just we see far, far less, and I think they've done a good job in mitigating that issue. All right, guys. So that's it. That's the crux of it. And I think, again, the take home is really have an open conversation with your veterinarian. Do not be afraid to talk about all this stuff. That's what they're there for. That's what we're here for. All right. And I think it's really important. And always too, I think on your end, so our end, on our end, it's our duty is to do what's best for the health of your animal, right? And really take each individual, right? On your end, what I think is really important, and I try to get my clients to remember this, is that good histories really, really help your veterinarian, help your dog or cat, okay? Your companion animal. It's detailed histories are so appreciated for veterinarians. I mean, Stephanie, you can comment on this but it's paramount. So just letting them know how often they're outside, and do they, some people, even with cats, some people say, oh, they never go outside. And then you talk a little bit and they're like, well, they don't go outside, but they get out once a week and they're gone for 3 hours, right? So you have to be honest, and you have to give a good detailed history, because that's really important. That's, that helps your veterinarian help you and your pet. So that's another big thing. All right. Okay, I have to talk about my sponsor really quickly for this week. My sponsor is the new Earth Animal Chicken Tenders. We did it on the last show, but I think 3 people saw it, so I have to talk about the sponsor. So anyway, snacking with a purpose, right? They're not your run-of-the-mill tenders. They have several different types. This one right here is Shine. It's got some licorice, dandelion, some zinc for coat and skin, right? This is a open dialogue, right, Steph? This is a look at what is involved. I hope you can see this. What's involved with these tenders? And there's several different flavors. This is fresh, right? So if you're sitting on the couch with your little guy, might have just had some fish oil or something, and your dog's hot breathing you on the couch, right? Well, parsley and mint, chicken tender, right? Give him an Earth Animal tender. Let them chew on it. Get the parsley and mint. It's delicious, and they'll stop hot breathing you on the couch, right? And delicious. So they're good. Some other flavors. Of course, there's plain. That's what you want. We also have mellow, right? Chamomile, lavender, and flex. There's another one. Look at how cool those are, right? Alfalfa, turmeric, glucosamine, chondroitin, right? Turmeric helps with inflammation, and you've got glucosamine and chondroitin for the joints. So take a look at those guys. Those are good stuff. Really, really, really good stuff. All right. You like that term, Candace? Hot breathing you on the couch? Yeah, we all know it. We all know it. Yeah, Tammy. Oh, yeah, that's okay. And Tammy, it's going to be posted, but Tammy just talked about she's a huge proponent of titer testing. We went over, I don't know if you just came in, Tammy, but so am I, and we talked about all this. Absolutely, you're 100% right. Yeah, Marianne, you can go on the website and your local independent retailer. They'll have them. They're great. They're great. Oh, thank you, Tina. So Tina says her two Corsos compete in the canine frisbee and dock dive. I think that is the coolest thing. In your earth animal energy formula of chicken strips, keep them going all day without fatigue. Thank you very much. That's a good plug. Thanks, Tina. All right, we have to do our quiz question. Sorry that I'm eating on camera here. These are good, though. Here's the quiz question. Now, if anybody's won in the past, please do not answer this. We're trying to, spread this around as much as possible so that we can have different people going to their independent retailers, right? But here's the question. Earlier on, I said, below what % of animals, according to most studies, have reactions to vaccines? First person to answer it correctly. So below what % of animals, according to most studies, have reactions to vaccines? We said it a little earlier. Oh wow, Tina, that's cool. She has her own suit. I would love to see a picture of that. That's very cool. No, not 5%. Here's a hint, it's lower. Keep going, guys. Marianne, you win. Marianne, you win. You get a gift certificate for Georgia. Below 1%. Good job. Great job. All right, I hope you guys enjoyed the show tonight. Sorry, my mouth is full with the chicken strips, but this is our show for this week. We won't be on Thursday, but we will be on next Thursday. I believe it's the 29th. And that is going to be a really cool show. We are going to be discussing pets with disabilities and their care. And we're going to try to do a panel format. So we'll have some guests, hopefully, if I could figure that out. But yeah, we're going to have some guests, and I think it's going to be really inspirational. So I would love you guys to tune in then. All right. I appreciate you guys hanging with me here at night, a kind of different little time. One of the things too, thank you, Dee. One of the things I will tell you is we are going to be, and I have some, by the way, don't go yet, because I have some questions I have to answer that people had sent in. I forgot I already answered them, but no one saw. I think that I would love to hear from you guys, as maybe you can weigh in on it, on what kind of times you guys might like the show to be. I have no problem doing this at night if it's easier for most people to watch it live, okay? So we're going to be looking at that in the future, all right? You're welcome, Marianne. Thank you. Congrats. Anyway, let me answer these questions quickly. Sorry. Ruth emailed, her vet found a fatty lump on her 7-year-old mixed breed. Her question was, what causes these? Should it be removed, and how to prevent? All right. And just without going on and on, because I know we're approaching an hour here, just Ruth, fatty tumors, fatty growths, typically what they say, they're called lipomas, all right, which generally is a benign growth of fat cells. Okay, so an abnormal growth of fat cells. Now, probably the most common growth that veterinarians feel. They're very, very common, and veterinarians are used to feeling them, and they can, with a pretty high degree of accuracy, you can tell. Is it 100% by feeling it? No, nobody can tell 100% with 100% accuracy by feeling a lump if it's definitely something, but you have a pretty good idea. Okay, so one is there, as far as prevention goes, no one, obviously there's some genetic basis to these things, but no one exactly knows exactly how to prevent growths. And they're working on it, but we just don't. Removal is based on a few things, right? Where it is, how big it is, okay, how fast it's growing, all right? One of the other thing that you always have an option of doing with a growth like that, even especially, if you're going to watch it and it's small, you can always do needle aspirates of these things. Very non-invasive. Use a needle, you put it on a slide, you send it to the pathologist, and they can tell you, all right, they can oftentimes tell you what the cell type is and what it looks like, and just to confirm that, yes, this does look like a benign lipoma. And then if it's small or if it's not in an area that's going to cause an issue, you can watch it at that point. But that's kind of in the middle, as opposed to just jumping in and taking it off, or if it's or just not doing anything and just watching it and assuming that it's exactly what you think it is. Okay, hopefully that helps. Patricia emailed in, 12-year-old mixed lab, has cataracts in both eyes. Patricia's vet does not recommend any treatment. Do I recommend treatment? Well, cataracts, Patricia, cataracts are a normal part of aging. There are very few 12-year-old animals that don't have some level of cataracts. Most of them do maintain vision through that. Okay, some can get severe, obviously. There are veterinary ophthalmologists that can do procedures to remove cataracts. One is it's very expensive, okay, thousands of dollars. And hey, Barry, thanks for joining us. Thanks for tuning in. So, it is extreme. Like the procedure for the cataracts is thousands of dollars. And oftentimes, if they're not significantly affected by them, then we don't recommend doing anything for them. Okay. But again, as we talked about with individuals, it's some may have significant impact to their vision. Again, sometimes it's not an age thing. We have, pediatric. We have young dogs that they can be born with a cataract or develop one very young, and those are different circumstances. You kind of have to take it case by case. All right. Trudy emailed in and said, "Why is my 12-year-old dog panting a lot?" What I will say, Trudy, is panting is very non-specific, believe it or not. And, the first thing that you would think of is, oh my God, they have a respiratory thing. Well, that's actually not true always. Okay. Certainly respiratory problems, lung problems, heart problems can cause panting. But panting can be from stress. Panting can be from pain. Panting can be from acid-base issues. So it is really non-specific. And certainly if you're seeing more of it, it's probably something that we should check out. Okay. All right. Last one, guys. Sorry. Marianne, how much canned pumpkin is safe for my 12-year-old lab? And I believe you ended up with it works well, keeping your lab regular. Well, bulk fiber, right? Pumpkin works well. Now you can overdo it, okay? Usually with pumpkin, a little goes a pretty long way. So a big dog, big lab, I usually just say, take a teaspoon, do a dollop, okay? There's some figures where they say like a teaspoon per 10 pounds, but I think you get, it's basically, but you don't want to give a bunch of heat because you can cause issues with too much fiber, obviously, right? So I think that remembered a little goes a long way, all right? They also have potassium in it and other things, it's not just for the fiber, but. All right, I think that's it, guys. Everyone, please be safe, happy, and healthy, and we will see you next Thursday.